It's being called the biggest outbreak of Ebola ever seen. Since February, close to 1,100 people have contracted the disease, and at least 660 have died. Those numbers don't include one of the latest cases, which has global health authorities particularly alarmed: the death on July 25th of a Liberian government official. What's so worrisome about his case? Patrick Sawyer died shortly after arriving in Africa's biggest city, Lagos, Nigeria, which is home to nearly 21 million people. Mr. Sawyer had flown there from Monrovia, Liberia, a country where the disease has now taken at least 129 lives. The World Health Organization has been warning that Ebola could spread beyond Liberia and the two other hardest-hit countries, Guinea and Sierra Leone, to neighboring countries. Also, that someone with the disease boarded a flight raises the specter of Ebola spreading beyond Africa. Did Mr. Sawyer infect other people? That's unclear. The disease is spread through contact with bodily fluids. The good news is that he was placed in isolation shortly after arriving in Lagos with symptoms of the disease. What are the symptoms? In the early stages, they resemble those of many other illnesses. They include fever and sore throat. That's why it's difficult to prevent Ebola victims from traveling. Is there a way to screen for it? There's no simple way. Ebola is diagnosed with a blood test, and normally it takes a few days for laboratories to confirm the results. Before someone dies, the more dramatic symptoms can take hold, which include bleeding from the eyes. Not everyone who contracts Ebola dies, but most who do die quickly.